The National Electrical Code requires isolated grounding in healthcare facilities to reduce the risk of electrical shock and ensure patient safety. Healthcare facilities are defined as buildings or portions of buildings used for providing medical or other services or treatment to persons suffering from disease, injury, or other health impairments per NEC 517.1. The NEC does not explicitly address health offices or first aid rooms in schools. However, these areas may fall under the category of healthcare facilities if they provide medical treatment and care to students. The definition of healthcare facilities in the NEC is broad and can include a variety of settings where medical services are provided. When determining whether an isolated ground is required in a school health office or first aid room, several factors should be considered. Firstly, the level of medical care provided. The types and complexity of medical services provided in the area should be assessed. If the area primarily provides minor first aid and basic medical care, an isolated ground may not be necessary. Secondly, the presence of life-saving equipment. If the area contains life-saving equipment, such as defibrillators or oxygen equipment, an isolated ground may be required to ensure the safe operation of these devices. Thirdly, the risk of electrical shock. The risk of electrical shock should be evaluated based on the layout and equipment used in the area. If there is a significant risk of shock, an isolated ground may be necessary. Based on the factors discussed, it is recommended firstly to consult with a qualified electrician. A licensed electrician can assess the specific needs and risks of the area and provide professional advice on whether an isolated ground is required. Secondly, consider an isolated ground. If the area provides significant medical care or contains life-saving equipment, an isolated ground is generally recommended to enhance patient safety. Thirdly, follow local codes. Local jurisdictions may have specific requirements for electrical safety in healthcare facilities. Always check with your local authority for any additional requirements. Ultimately, the decision of whether an isolated ground is required in a school health office or first aid room is best made on a case-by-case basis by a qualified electrician, taking into account the specific circumstances and risks associated with the area.